Well, have you ever heard the saying, big things come in small packages? That is exactly what we're talking about today with Dr. Rakesh Nanda from Grandview Aesthetics Center as he explains a simple way to help us feel younger and help prevent age-related illness, which is so important. So good to see you, Dr. Nanda.
Thanks for having me again.
Okay, we're talking about something called BioTe.
Yes.
You explain what it is for us.
So BioTe is a company that does hormone replacement therapy. So we all age with time, right? And that's something we can't prevent, but we want to age with grace, want to age naturally. So what BioTe basically does, and the whole concept of hormone replacement therapy, is trying to help us live a better life. So we all, sometimes we get annoyed, we get aggravated, we suffer from lack of sleep, with a little bit more stress that may have an effect on our sex drive. We try to eat well, work out, but yet we just can't lose this weight. So what happens a lot of times is you go to your primary care doctor, what they'll do is they'll toss meds your way. They'll say, oh, well, you're depressed. Let me give you some Prozac, some Xanax, some Lexapro. And oh, doc, I can't sleep. Okay, well, here's some Ambien to help you sleep. Half the time, those meds will cause more side effects than good.
Right.
And the real problem is not really that you have those issues going on, it's that your hormones are imbalanced. So what we basically do is, it's very simple. You come in, we sit, you meet with me personally, we talk face to face, and I do a simple blood test. That's our screening test. A simple blood test, we go through every major insurance for that. So that part's covered, and we get a whole series of labs. We can then look at those labs, and we can actually put what you're deficient in into what's called a pellet. So testosterone, estrogen being the major things, we put into a pellet. We implant that underneath the skin, and then it releases itself over time, and you're done. For women, you're done for 4 months. For men, 6 months.
Okay, and we're looking at a picture. So this is literally a tiny pellet, as you mentioned, that goes under the skin. Explain the procedure, because some people might think, okay, that's odd. How do you get it in there?
Sure.
What's the process?
It's an extremely simple process, actually. It's nothing extravagant, basically. So what we do is we use a local anesthetic, just like lidocaine. We do a small incision after that. So you're completely numbed up. You actually don't even know what's going on. Most of my patients, when I do it, they don't even know I'm doing this. They're like, oh, I didn't even know you're done, and we're done. So we do a small incision, we implant the pellet in, which looks like the size of a Tic Tac. You saw a picture of it there.
Yeah.
We then put some steri strips on top. We don't even do any stitches, just some bandage, which is a steri strip. We then put a coating on top of that to protect those steri strips, and you're done. That's it. It's a 5-minute procedure, and you don't have to take any other meds. There's no prescriptions involved. You're finished. As a woman, you'd be done for 4 months.
Okay, I was going to say, so does it slowly kind of leaks into your body?
Right.
What is that?
Right. So basically, that pellet will dissolve on its own with time, and it will dissolve according to what's called your cardiac output. So the more active you are, the faster you'll kind of burn through your pellets. So if you're a very, very active person, it'll go through a little bit faster. If you're not as active, then it'll last a little bit longer. But on average, about 4 months for women, 6 months for men.
How do you figure out the dosing? Are they different for men, for women?
That's the cool part about it. So we've actually, with our experience, we've actually able to get this down to an exact science. So I look at it, I interpret your lab. So a lot of times when people look at their blood work, they see this range, but that range is the same for someone young all the way to a very old individual. And it's the same a lot of times for men and women. So when they see this range, they say, oh, I'm good. Everything says I'm in the median and I'm fine. That's actually not true, because as a 35-year-old, your labs will obviously be different than an 80-year-old.
Okay.
So we interpret it exactly according to your age, what you're supposed to be down to a T. And that's why we like fresh labs, so we can get it according to how you are right now.
And your patients are having great success with this procedure itself. So why do you think it's making such a difference?
So what happens is testosterone is one of the most beneficial things on a body. It actually helps prevent heart disease, it helps prevent stroke. In women, it'll prevent breast cancer. In men, it prevents prostate cancer. So for years, people are so scared thinking that testosterone is harmful for the prostate. It's actually low testosterone, not increased testosterone, that causes prostate cancer. It's actually low testosterone that promotes more breast cancer. We've actually done studies, and we've seen that testosterone helps prevent breast cancer. So we're actually helping men and women. Number two, we're helping you be more happy with your life. So, you sleep so much better. So you can sleep 6 hours, but you feel like you slept 10. You're losing weight. It's boosting your metabolism. You're getting more out of your workout. We're doing this naturally. You're prolonging your life, living a better life. We're saving marriages, making relationships better, and just making you happy day to day.
Okay, it all sounds amazing, and it starts with a consultation, right?
Starts with a consultation. Remember, you have nothing to lose. We go through your insurance for the labs. The cost of this is very simple. It's about the price of a cup of coffee a day from Starbucks. So, people get a cup of coffee because they want to feel that perk. If you can feel better, live better, get way more out of the coffee than a $3 cup of coffee, and you can get this done, it's a better way to go.
All right, Dr. Nanda from Grandview Aesthetics Center, all the info on screen. Thanks for being here.
Thanks for having me again.